Welcome back to Africa 54. This week, we're bringing you the story of one woman and her battle with breast cancer. Africa 54's Ndimyake Mwakalyelye joins us now with part 2. Ndimi?
Yes, thank you, Vincent. Well, chemotherapy can be used to treat many different cancers, including breast cancer. It kills the malignant cells, but has painful and sometimes unpleasant side effects. VOA's Carol Pearson talks to former VOA reporter Zuli Palacio about her personal experience with chemotherapy.
I'm a little bit tired. I'm okay.
Zuli Palacio's husband, Chris Kundeti, takes her to every one of her 6 rounds of chemotherapy to combat stage 3 breast cancer.
Oh, yeah.
Palacio had a medical device surgically implanted in her chest.
And 1, 2, 3. Take a deep breath. There you go.
To make it easier, if not less painful, to deliver the drugs.
Chemo is not painful. Chemo gives you a tremendous amount of fatigue.
All right, this is your steroid.
Palacio's chemotherapy sessions last 6 hours on average. During that time, she can talk with a nurse about some of the side effects of her treatment.
Now, are you having mouth sores more in the front of your mouth or in the back of your mouth?
Palacio says the hardest part is the injection the day after the chemotherapy session.
The day after that injection, you feel like if a train hit you, your body flew through a black cloud, and you land in a cement bed. Your entire body hurts and aches. The bones, like this big bone in your legs, it hurts. You can basically feel your bones bleeding.
Aloxi, your anti-nausea medicine.
Chemotherapy is used to keep the cancer from spreading, slow its growth, cure the disease, or to shrink tumors before surgery. But it also has debilitating side effects. It kills rapidly growing cells of all types, including those that make up hair follicles.
This is gonna be my hair for the next year. I got a free wig from the American Cancer Society.
Palacio's hair started falling out after her first round of chemo.
I don't have much practice yet. So basically I will spend almost a year with no hair. It's going to be hard because I always love my hair.
Another effect is unofficially called chemo brain. Patients have difficulty remembering things.
I have caught myself reading the same paragraph 3 and 4 times and it doesn't register. I read it and I don't remember where I left things. More than ever before, it's not just the aging process, but it's like what is happening to my memory.
Positive way of looking at this with treatment.
Palacio's doctor, a cancer specialist, says if she completes the treatment recommended, her chance of beating the cancer is 85%.
We're hoping to cure you.
Which is why she and other breast cancer patients endure chemotherapy, hoping to be cured.
I don't know if I want to be an old lady.
Well, that's a different thing.
Carol Pearson, VOA News.
Now, to discuss this further, we're joined by Rebekah Ndinda Negewa of the African Women's Cancer Awareness Association. And, well, first I should say thank you so much for being here today. You're watching.
Thank you for having me.
No, it's our pleasure. So you're watching the story. The symptoms that Zuli Palacio is, described so elaborately, from fatigue to pain to memory as well as hair loss. Is that a universal experience for people undergoing chemo?
Well, the first thing people need to know when they go through chemotherapy, it's a subjective experience. So what one person goes through, the side effects wise, might not be applicable to the next person. Mm-hmm. So the most important thing is to discuss with your doctor so he can tell you what all the other possible side effects might be, but then your experience might be different.
And what do you do when you're confronted with these kind of very drastic changes? I mean, what she described as the pain, so excruciating, the memory loss. I mean, people obviously would get a little concerned.
Yeah, it's very concerning, and with cancer diagnosis especially, chemotherapy makes the cancer real for the patient when they're going through chemotherapy. And to address some of the side effects for the chemo brain, for example, what we recommend for patients is when they go to the doctors for their appointments for the treatment, to go with a chemo buddy, someone who can go and take notes for them and be there to get all the information from the doctor, because oftentimes you may forget what the doctor is saying, you might not be able to communicate effectively what symptoms you're having. So having somebody be there with you to make sure that they're taking notes and getting all the information for you is great. And then in regards to the fatigue, it's not, a lot of people go through fatigue, usually between 80 to 100%, depending on what their cancer treatment regimen is. But the most important thing for them to do is try as much as possible to keep active.
Not to rest.
Not to rest, even though it means, 15 minutes a day, even though it's walking from the house to the mailbox. Just small steps, because the more you move around, the more energy you might get. And it's usually right after you get the chemo treatment that you're experiencing some of the worst fatigue. But then, just know your body and make sure you gauge to know when you need to move around. But it is important to keep moving for them.
What about hydration?
Hydration is crucial. So some of the 3 components, making sure they're drinking water, stay hydrated. And after chemotherapy treatments, it's important for them not to eat or drink anything after an hour, because, or to wait at least an hour before they eat or drink, because that would decrease their nausea and vomiting side effects that could possibly happen, as well as, physical activity, as I mentioned, and also nutritious eating. And they might lose their appetite, so what might be important is to have something that's easier to go down, like a smoothie or a fruit shake that way.
Supplement.
Yeah, something supplemental.
Now, you're currently a PhD student, and this is one of the focus areas that you're working on, breast cancer and how it's affecting the African population here. Of course, cancer affects everybody, as I'm finding out. What are you finding out about what is driving and fueling this cancer among the African community?
Well, our focus for the African Women's Cancer Awareness Association, our goal really is to break down the barriers of silence. What I'm finding is women in our community do not want to talk about cancer. It's something people suffer in silence, and we're trying to empower women to know that cancer itself is not a death sentence. There are a lot of people who've survived and are thrivers with this disease. So what I'm finding is just a need for us to discuss what our barriers are to cancer, be it transportation, be it cost, and then partner with organizations in the community like the AWCAA that is working to really empower women and provide services for them.
Are you finding a lot of incidents of cancer in the African population?
Yes, we are. And the really disturbing thing is we're finding a lot of incidences more so in younger women. So in our populations, women are younger than 30 or younger than 40.
Why is that? Very quickly.
It's because a lot of people are not getting their prevention earlier. So by the time we discover the cancer, it's metastasized and it's at late advanced stages.
Prevention, prevention, prevention. Get checked. Mammograms.
That's correct.
Thank you so much. Invaluable information. Rebekah Ndinda Negewa is a doctoral candidate in preventive health care with a focus on population and reproductive health. She's currently interning at the African Women's Cancer Awareness Association here in Silver Spring in Maryland. And that's our Africa Health Network report for today. Of course, for more health news and developments, please be sure to visit our website, africahealthnetwork.com.